ability that this will all be taped and kept for the record. So we'll be looking at it that way again. We also have an aide from the budget office who's here to help us and to take notes, so that'll be doing. Looks like by the number of people that we have wishing to speak, and I want to tell you, if you've walked in the room late and you still want to speak and you haven't signed up, it's okay. We'll find the time to do it. That's what this is about today, is to really hear the concerns. I'm going to try to put the issues sort of together so we can stay on task rather than necessarily in the order that you signed up, so that, you know, when we're talking about one thing, and some of these I may not even know right. So if we're, like if for instance we're talking about the child advocacy centers and you are actually one and I don't understand that from the way you signed in, I want you to feel like you can raise your hand and let me know. We're going to have a very open sort of conversation here this afternoon, so I want everybody to try to take a deep breath. I need to, because I just ran up those stairs and those last two are really dreadful, y'all know that. So let's just try to begin the conversation and see what the challenges are, what the concerns are, and as we go through the budget process, what we think we can address here. Okay? First of all, and we're gonna talk into this microphone here because the way the cameras are, that's the only way we can pick it up. So, Carmen Allen, if you would come up, and this microphone right over here to my left, and we'll make sure it's on, and guess you. We're going to allow 5 minutes, and I have great help here from Appropriations. Miss Catherine is going to give you a 1-minute warning, and then also she'll flip it around and say time is up. And she's experienced. She's already done this in Health and Health, right? Health Appropriations Committee. So we're going to try to make it work and give everybody about 5 minutes. So be thinking about what you need to say. And Carmen, whenever you are ready, we are. It may not be on. Let's see. There's
just switch it up on top, the little black button. Okay.
And we'll just leave it on.
Okay. Hello, my name is Carmen Allen, and I'm an advocate. I have been working with at-risk children and children with disabilities as a volunteer for many, many years, over 12 years. I'm here because I'm concerned about the behavioral therapies that we're giving to children in the state of Georgia. We've been giving behavior therapies to children now since 1972. That's how I've tracked it. And there are children that are being harmed. There are children that are dying. And I'm really concerned that we have legislation where we may be putting money into the community to have these very same behavioral therapies. And one, parents are not aware that there's potential harm. The Agency for Healthcare and Research Quality on April 4th, 2011 determined, after researching all of the behavioral therapies, that there was potential for harm and it should not be discounted. They also said that the evidence behind behavioral interventions was low and of poor quality. And my concern is that we're taking money and we're going to put it out into the communities, and that parents are not aware that their children can be harmed. I wasn't going to come to the Capitol this year. I've been here the last 2 years. I had decided I wasn't going to do this anymore. I came here because I got a phone call from a mother, desperate, in Valdosta, whose child was being put in a seclusion room. They called it an opportunity room, 8x8 room, and she could not find help anywhere in the state of Georgia. She had been looking for a 1.5 years. She doesn't have money. No one would help her, and that's how she got to me. This therapy, or evidence-based practices, are allowed.
Coming in, there are so many meetings on top of meetings, but we do have, thank goodness.
Once a functional analysis is done, what they can do is they seclude your child, and there's a systematic manipulation of the environment to purposely trigger the behavior of the child over and over and over again to establish function. Children are getting PTSD, anxiety disorders, eating disorders, and all sorts of other issues as a result of this therapy. Some of them attempt suicide, like one in Gwinnett. Some of them come home banging their head on the wall, like one in Cobb County. One of them hanged himself in Hall County, Jonathan King. $1.1 million was spent by Atlanta Public School System because a child was hurt there before they settled. Parents are homeschooling because they don't want to go through these psychological experiments. Many parents cannot afford to homeschool. So what I'm trying to say here is we need to collect harm data, because harm data is not collected in non-medical studies. And unless we have harm data, we really don't know the efficacy of these behavioral interventions. And everyone's going, oh, I'm going to get free ABA, or I'm going to get free positive behavior supports in the community, and it's $100,000 therapy. I'd like to know what the incremental costs are after a child gets any kind of ABA therapy, whether it be positive behavior supports, early intensive behavior intervention, discrete child training, any of those, school-wide PBS. Anyone can be subjected to that. And I want to know what are the incremental costs after any of those behavioral interventions are given. Because that plus the harm data is going to give us the true cost of what happens. And I just want parents to be informed and then opt out so that they realize, hey, there's potential harm here. Thank you very much.
Thank you. Okay.
Can I just say one more thing?
I talked to a senator on my way up, and when I was explaining this, they said, well, I know the people behind the bill, and they're really good intentions. I have no doubt everyone has good intentions. I just say we have dirty data, and we have bad data, and people have been misinformed. That's it. I don't think anybody is out to get anybody and do anything to children. I do believe everybody comes together for the good of kids.
Ms. Allen, let me ask you one question.
Okay.
And the bill that we're focused on here right now is the appropriations bill.
Mm-hmm.
So you're talking about what bill, just so that I have it?
Well, I'm not really talking about any bill here.
Oh, okay.
I'm actually talking about, well, there's several bills that are going around now in the Capitol that are actually going to bring in behavioral therapies. And it's, that's a whole nother issue. I'm not talking about those bills in particular. I'm concerned about the Department of Behavioral Health ending up also doing this therapy out in the community, and parents have no idea for the potential of harm. They have no clue. And that's all I care about, because you all are serving people in the community, and I'll even put it one step further. I went to a meeting where I actually heard someone from the Behavioral Health Department suggest to a parent not to write certain things that the child needed in an IEP. And I'm sitting here going, what are we doing? So, there's just a lot of issues.
So you're concerned about DBHCD funding for this?
Yes. And we need to know what behavior therapies cost, the real cost and the real harm, before we continue to fund it. We spent, I think it was 86? Yeah, we spent, I believe it was, I don't know the millions now, but we spent at GNETs. We can use that model. If you take GNETs, you can use that model because they are specialized and trained in behavioral-based interventions and support services. If you take that model from 2010 and that audit, and you multiply that and harm the data, that's really going to be your cost.
Okay. Thank you. Seeing your concerns known.
Thank you.
Okay, is there anyone else here particularly to speak to behavioral health issues? Okay, great. I didn't think so, but I want to make sure. The next area that I'd like for us to start to focus on are the child advocacy centers. And I think Nancy Chandler was up first, and then anyone else who's here, if you'll just make sure that when she finishes that we go ahead and hear from you on that subject.
Thank you so much, Chairwoman Dempsey. My name is Nancy Chandler, and I'm the director of the Georgia Center for Child Advocacy, which is the local children's advocacy center providing services to abused children in Fulton and DeKalb counties. Today I'm representing the Children's Advocacy Centers of Georgia, and many of our members are here. If y'all want to... we were quite lucky that the hearing happened to be the day that we were all in Atlanta. So good for us. I don't know about for you guys, but I'm here today to speak to an issue that has a very profound effect on services to child victims across Georgia. Yeah, y'all can see them. Which is the result of a proposed $240,000 contract elimination in the FY 2014 budget. As many of you know, the Children's Advocacy Centers of Georgia have been a source of help and healing to child victims of abuse for more than 20 years. These programs did not simply come into being because of the need to help a child, but in part because of the strong training, technical assistance, and mentoring that has been offered to these programs by our state chapter, the Children's Advocacy Centers of Georgia. Our statewide membership organization has raised the level of standards of services to abused children by making certain that the needs of the children, their families, and of the professionals that we work with are met. Approximately 5 years ago, the funding to support our centers and our network was shifted from the Children's Trust Fund of the Governor's Office for Children and Families. This relationship has worked well, and we were pleased that we've been able to open several new centers, strengthen our reporting requirements, and make certain that every member of our network meets our state standards. Last month, we were shocked to learn that the Governor's Office for Children and Families intends to eliminate our contract that allows us to provide training, technical assistance, and program compliance and funding to the state network. We learned by email just a few weeks ago that as of June 30th, 2013, the Governor's Office intends to fund each of the 34 individual centers directly through an open request for proposal process. Staff of the Governor's Office has called our members directly, announcing this change and letting them know that the RFP will be issued in March, with the proposals due in May. This unexpected outreach by the Governor's Office to the individual centers has caused our centers a lot of great uncertainty and anxiety and great distress for those of us who believe so strongly in the power of an organized, effective state chapter. For more than 20 years, we have funded member centers based on the number of abused children needing the services within each unique Georgia community. Moving to a competitive bid process may be great for buying computers or consulting services, but doesn't feel like a good idea when trying to help innocent child victims bring their abusers to justice. Subjecting each center to another level of administration to manage a contract with the Governor's Office takes them away from what they should be doing, spending time serving the children of Georgia. We also have grave concerns about centers losing their accreditation and not maintaining compliance with our state and national standards. We believe the proposed change is neither warranted nor is it good policy. Speaking for the state chapter, we believe that we have been highly successful in bringing these centers into compliance with standards, providing training and much-needed technical assistance to centers, and working together to benefit thousands of abused children in Georgia. We appeal to you during the budget process to help us correct this decision on the part of the Governor's Office. Thank you very much.
Thank you. Now, are there others here that wish to speak to the Child Advocacy Centers? Okay. Thank y'all for being here so much. You're welcome to stay. Y'all are busy ladies, I know. If you need to leave, I certainly understand that. And I thank you so much for the work that you do in your communities. Make a big difference. Okay, so from there, Juliana McConnell, are you here? Yeah, come.
I couldn't see. Is this the one that she was saying?
That one right there would be great.
Okay.
Whenever you're ready.
Okay, thank you. My name is Juliana McConnell, and I'm here today representing the Service Providers Association for Developmental Disabilities, better known as SPAD. SPAD is Georgia's largest association for providers of community-based services for individuals with developmental disabilities. Our membership consists of 84 organizations statewide, serving more than 6,000 individuals with intellectual and developmental disabilities and their families, representing the vast majority of individuals who are now served by the NOW and COMP waivers. SPAD's mission is to improve services to persons with developmental disabilities in Georgia, which means that services must be adequately funded to support their needs in a manner which is safe, person-centered, and meets federal and state requirements, including Georgia's current requirements to safely and appropriately move individuals from institutions to the community as mandated in the settlement agreement with the United States Department of Justice. First, today, we come before you, your Appropriations Subcommittee, to express our support for the DBHDD 2014 proposed budget. We first would like to also commend Commissioner Frank Berry and the management team that he has put in place, as he emphasized and promised that he would work in partnership with providers. In fact, during the first 6 months of his leadership, he has proved that in fact, that is exactly what he will do. He's already appointed a 13-member advisory council in order to truly work in cooperation and in partnership with providers. The commissioner told providers that he, his department staff, and the governor's office worked together to present a 2013 and a 2014 budget that did not cut vital dollars to our providers, dollars that therefore then go to our developmental disabled individuals who receive the services from our providers. So we certainly encourage you to approve the 2014 proposed budget from the Department of Behavioral Health and Developmental Disabilities. As representative of SPAD, I would, however, like to express our great concern over the DCH, the 0.74% cut for the home and community-based services, specifically the now and comp waivers. And we realize that that the DCH does not fall under this committee, but the providers from the DBHDD, of course, do fall, and it does have an impact, as the Commissioner, as Commissioner Berry has already told this your committee. These Medicaid waivers are meant to maximize the use of state dollars to support individuals with developmental disabilities and safely and appropriately provide them with community-based services and support. This is the primary funding source for individuals with developmental and intellectual disabilities in our state. I would like to, in closing, just, we had the president of the ARC of Carroll County, Cindy Britt, testified last week before the Health Subcommittee. And I would like to just share just a couple of, and she could not be here today because she was at the training center in Carrollton working with our developmental disabilities population there. She works 2 days a week volunteering, so she could not be here today. But just a couple of the comments that she made. She is not only president of ARC, but more importantly, cousin and guardian to Ray, Billy, and George, all three who were born with intellectual disabilities. Since the passing of her aunt and her uncle more than 15 years ago, her role to, as she calls, My Guys, has been their mom and their personal advocate. My Guys receive community-based day support services funded through their comp waivers. During the day, they choose to go to a center where they can work and socialize with their peers. They can go bowling, bicycling, enjoy art club, garden club, and such. And I get a peace of mind that they are safe and enjoying their day while at work. As she closed, she said, please understand that even the slightest reduction severely impacts the vital services that would to the lives of our Georgia citizens with special needs. A wise woman once said, as she said, it takes a village to raise a child. Well, consider that it takes an entire state to raise and care for an individual with developmental and intellectual disabilities. And she closed in saying, we really shouldn't let them down. Thank you.
Thank you so much. The next person I have on here says Team Rep Child Advocacy Centers, but I don't, I think maybe that was just a placeholder or something in there. I don't know. I didn't see it. Kathy Floyd, would you like to step up and share your concerns?
Thank you, Ms. Chairman. I am Kathy Floyd. I'm the State Legislative Director for AARP Georgia. We have right at 1 million members in the state of Georgia. I come to you with concern about two of the line items, cuts in elderly services. State funds for aging services have been cut $9.9 million from FY09 to this FY14 budget. That's almost an 11% cut. The cuts that I'm going to highlight really do place elderly Georgians at greater risk. The almost $500,000 cut in Alzheimer's and respite care services, that will negatively impact caregivers who are keeping their loved ones out of much more expensive nursing homes. And the over $500,000 cut in elder abuse investigations and prevention will eliminate 17 positions of family service workers. They are currently helping almost 1,800 people. These family service workers aid the elderly who are the neediest and most at risk of abuse, exploitation, and neglect. They not only take these clients to get their medications and groceries, but also spend time with them in their homes. And the work that these family service workers do relieve the caseworkers of a burden so that they can concentrate on investigation. So we know what's going to happen if these 17 people are eliminated. More of that burden is going to fall on the caseworkers with APS. And that's really my what I wanted to convey to you today about our concerns.
Thank you so much. I appreciate it. Next, I think Holly Comer-Tuchman, does that? Tuchman, I'm sorry, with the YWCA.
Yes, I'm part of the DB group. Are you ready to start?
Okay. Is there anyone here that is anything other than domestic violence or sexual assault centers? Okay. Other than...
Did you want me to go behind Kathy since I'm doing aging?
That would be great. Yes. Yes, that's what yes, that would be great. I'm so sorry.
I'm sure you had...
I know. I don't understand all the initials, so just forgive me. Yeah. Yes, Nancy, thank you.
Thank you. My name is Nancy Petra, and I'm the Senior Citizens Advocacy Project Coordinator. This is a collaboration between the Georgia Gerontology Society, the Georgia Area Agencies on Aging, and the Georgia Council on Aging. I'm going to completely echo and talk about the specific cuts that Kathy Floyd from AARP also spoke about, so I won't go into the detail that she did. But just to reiterate and say some things I'm sure that you've heard before about the aging population in Georgia. You know, Georgia has the 9th fastest growing population age 60 and over. You know, we're lucky in some respects because a lot of people want to bring their parents and their loved ones here to retire, and some people want to move here to retire in Georgia. But the rise in this elderly population also brings on a need for increased support services. And Adult Protective Services has experienced a more than 50% increase in reports of elder abuse, neglect, and exploitation since 2007, as we've had this continual rise with this population. Despite the increase in their caseloads, the staff has not been increased at all to keep up with this rise. Georgia, we do not even have one APS investigator for all 159 counties. We have roughly 130 caseworkers for 159 counties, and y'all know as well as I do, some of those counties are really large. It takes them a few hours to go out and investigate one case. So with the rise of the population, the rise of this kind of abuse, we're not equipped to be able to handle this. So I echo what Kathy Floyd said about we need to keep those 17 APS caseworkers in place to help that older, needy population. There's also been a rise in essential services, and the fiscal year 2014 budget is reducing the state funds for these essential services and is setting our state funds at the minimum required level to receive federal funds under the Older Americans Act. A cut of just one more additional dollar at this point is going to jeopardize all of the funding that we get under this act. So they're reducing the funds for Alzheimer's services and respite care by $484,000, as Kathy Floyd said, and this is directly going to affect the quality of life of our older Georgians. This reduction will cut tens of thousands of hours of services, such as adult daycare and respite for caregivers who take care of those in their homes. There are state services allow the older Georgians to live in home and community-based settings, which is at a much cheaper cost than when they go into institutions and they start adding those high-cost dollars to our Medicaid budget that we already know is somewhat out of control. So by restoring these cuts, you will help older Georgians stay in their homes longer. You know, it's very cost fiscally for our overall Medicaid budget, and will take care of our older Georgians and allow them to have the quality of life they deserve. So we respectfully request that we try to get these cuts restored if possible.
Okay, thanks. And Ann Williams.
Thank you. I'm Ann Williams, Legislative Chair for the Georgia Council on Aging, and I'm here today because we are very concerned about this $6,154 governor's cut in the fiscal 2014 operating expenses of the Georgia Council on Aging. It's line 27.21.1. But as you all know, the council was created by the General Assembly in 1977 and is the advisory body on aging issues to the governor, legislature, Department of State Government. Now, this $6,154 doesn't sound like much, but it's already part of a limited amount of money that's being given to the council, and it will ultimately restrict staff travel and staff support of the council members, because what this staff money does, if we don't spend it, it also goes to help with the council members' expenses. And the council itself will be impacted because we serve on advisory committees, work groups, implementation teams, attending council members to coordinate this statewide advocacy with co-age advocates. And the council has absorbed its fair share of funding reductions, losing over $51,000 from the original FY09 budget, as well as incremental decreases in recent years. In response, what we've had to do is reduce council meetings from 6 times a year to 4, ask appointed council members or their employers to pay their travel expenses, changed all committee meetings to teleconferences, halted on-site training outside the metro Atlanta area, ceased paid training for council members and staff. Now, we deeply appreciate your appropriating funding last year to offset the deep cuts in this small budget. But the cut recommended by the governor this year takes away the appropriations you made last year and even more. Our council members and our small staff are dedicated to providing the kind of service to state government which is charged in the enabling legislation in 1977. But we need basic funding in order to do our work, and we thank you for your consideration.
Thank you so much.
I'd like to give you something to read later.
That'd be great. Okay, so does that get us to the point where now everyone in the room is focused on sexual assault centers or domestic violence, rape crisis centers? Is that where we are? Good, good. We'll pass these out as we get ready to leave in a little bit. Because I want everybody focused and thinking here on this one. Okay, the first one, I think, Holly, was that Holly Huckman? If you... Sure.
Thank you very much for this opportunity to come and speak about some concerns that we have about the new process upcoming with the Governor's Office on Children and Families. There's been a big shift in the way funds can be spent from an administrative standpoint. Shelters already are held to a standard in other grants and agency audits for keeping admin costs low. These funds many of the funds we get from GOSEF have been able to be used over the years for some things that perhaps other grants we could not do that. Many of the expenses that we believe that have been labeled as admin are actually costs directly tied to serving victims in a confidentiality located shelter. Other expenses are left for the funding applicant to justify in writing why they should be considered direct costs. Some of those include our security system, which we need to have in order to keep our clients safe. Our outreach advocate, cell phones for our direct service employees, rent and utility for office space for our direct service staff. All of these things we must justify in order to have them covered now under GOSIF, where in the past we have not had to do that. Also, from an indirect standpoint, liability insurance is being considered an admin cost, but as we all know, we need to have that in order to function as an organization. Also, employee travel to grantee trainings. We are required, myself, to attend certain GOSIF meetings and have been told we cannot charge those costs back to the GOSIF fund, even though we'll be required to be there. Our copier, our postage expenses are considered indirect costs when many times those are costs that our clients need to have in order to have the documentation that they need. Rent and utilities for some of our offices, as I indicated before. And while we realize we need to be responsible for the funds that we have, some of the concerns that I have in justifying these costs, if one organization has a grant writer that could write a justification in a certain way and someone else doesn't, it could provide that some programs get those services paid and others don't. And that seems to be too much inconsistency. Also, I think there's been a few transparency issues. We had a funding cut in our last grant cycle, which I don't dispute the fact that we missed one of our targets that were on the contract. However, when having the conversation with staff, where were these funds going to go, and was there an opportunity to perhaps secure them in the next grant funding process if we met the standard that we are required to meet per our contract? I was told that they weren't sure they wanted to share at this time where those funds were going. That causes me grave concern when these are taxpayer funds, our funds, your funds, and their funds, that we're not being told where funds that are being withheld from us are going within the program. Also, recently there was an RFP process for some funds for outreach to military communities, and there was a select group that were chosen to apply for this RFP. I live in Cobb County, and I'm sorry to not say where you mentioned where I was from, but the YWCA in Cobb County, and for those of you that may not know, we have Dobbins Air Force Reserve Base, and all of the National Guard throughout the entire state of Georgia come to that base for training, and we were not afforded the opportunity to apply for that RFP. And so when I found out through my peers, I did reach out to the office, and of course there were a couple of places that had military bases that did not apply, so I was afforded the opportunity this week to apply for those funds and to have the RFP in by Monday, but the question still remains, why was that not open to everyone to apply, and especially to a community that has a base that size, where we have an opportunity to reach out to 1,000 military folks. So while we agree that this process needs to be competitive and that administrative costs should be kept to a minimum, because that's good steward of taxpayer dollars, the problem we feel is the speed with which all of these very drastic changes are happening, and with no reasonable explanation of why it should be so quick. And as we have shared with GOSIF, we are very, very concerned that shelters will close. We don't believe that's anyone's intention, but if we continue down this path that has been relayed to us in the last week or two, I am very concerned that we will lose shelters within the state of Georgia and therefore we'll have big gaps of services to those who are the most vulnerable, and those are the women and children and men who come to us for protection. Thank you for your time.
Thank you. Next, Amy Weaver.
Thank you very much for the opportunity to be here today, and thank you for coming to hear us out again, too. To take from what Holly has already addressed, first of all, I'm Amy Weaver. I'm director of a domestic violence program in Rome, Floyd County, Georgia. I'm also the board chair of the Georgia Coalition Against Domestic Violence, and I'm nervous right now.
Don't be nervous. Don't be nervous.
I'm in a really scary room.
We're not scary at all.
Stop this stuff. One of the big concerns that I have, as well as others throughout this process, has been in rolling out plans for the upcoming fiscal cycle. The Governor's Office of Children and Families contracted to create a needs assessment through Georgia State University, while choosing not to go with the work that's already been set forth through the state plan for the state of Georgia, as documented through the Georgia Commission on Family Violence with 20 or more stakeholders from across the state. Stakeholders who know the needs across the state, who know the issue, and who were mindful to pay attention to what would be best practice in trying to find the gaps in service and to best fill those gaps. It was confusing that that plan was not considered in the development of their new RFP and the allocations formula. Cuts, even though they may be spread over 3 years after much pressure from advocates and others, and we appreciate that you're willing to split the cuts over a longer period of time. Under the new funding formula, with the cuts that are proposed, my program specifically could stand to lose $25,000 a year, 3 years straight, to the tune of $75,000 total. Although I do appreciate, like I said, that would be spread over 3 years to sting a little less. A $25,000 cut on top of the administrative capping costs that you already heard about would be crippling and quite dangerous for the program that I work for and serve. And I feel like, even though it's awkward to be here today refuting plans of a funder, I feel like I'm not doing my job at home if I don't come down and speak to these issues. The new RFP, the request for proposal process, and the standards by which we are now being governed have been rolled out quickly, with little explanation and little or no training, other than having the documents actually read to us in person. Some of the standards were added arbitrarily over issues that may have been isolated and could maybe be addressed better through technical assistance to the programs that may be suffering from those kind of problems, rather than rolling out blanket rules. The competitive funding process, without time to adjust to these other changes, just further weakens our ability to try to hold up to these standards and to deliver the good services that we hope that we are delivering. Our attempts to collaborate in person and in writing, and even through Commissioner Reese at DHS, have resulted in little or no compromise. We have had a little more conversation, but very little changes. We did, in fact, receive notification that some of the indirect and direct costs had been adjusted, which will help some. But long and short, with all of these changes being rolled out at once together and not having the opportunity for discussion as to what the urgency is, what's behind it, why it has to all happen at once, it's confusing and it's difficult, and it makes it feel a lot more dangerous for us. It also is confusing that if our goal is to figure out gaps in the programs where people aren't getting served, if there are problems and we are just learning how to do business with each other as a funder to a program, it's upsetting that we don't have the opportunity to work on a more technical assistance basis to try to remedy these problems. If there's something that my program has been doing incorrectly to result in this $75,000 cut over the next 3 years, it would have been nice to know, so that we could work on fixing the problem rather than just receive a cut for having done something that we're unaware. It seems to me to be better practice to work with the programs that might be suffering from improper administration of the standards, so that they can do better work, rather than pull funding and ask someone else to step into a community to do that work when relationships have already been established within communities where they've been working for years and years. I'm confused that that would seem like a smarter way to use state dollars. I think that we all hope to be able to do the best we can with the funds that we get. Thank you.
Thank you, Amy. Appreciate it. Shelley Centrifit.
Thank you, Madam Chair, members of the committee. I'm Shelley Centerfit, and I represent the Georgia Coalition Against Domestic Violence, which is the statewide coalition of domestic violence shelters and other organizations working to protect victims and their children. And I'm going to be talking to you about some points that Dee Sims had hoped to present, who's the director of the Macon shelter, but she got held up in court this morning. So she has sent me some information that I want to share with y'all on her behalf. And just to be clear about the funds that we're talking about, because I do think it's a little confusing, there's about $14 million in state and federal funding that's actually within the Department of Human Services budget. It's a line item that says Family Violence Services. However, for the past 3 years, those funds have been transferred administratively out of DHS and into the Governor's Office of Children and Families. And so GOSEF has been handling the domestic violence funding in that way, even though the funds still appear in y'all's budget under DHS. Additionally, there is a state statute that provides that the Department of Human Services is the state agency responsible for funding and regulating domestic violence programs. It's OCGA 19-13-20. That statute has not been changed. So from our perspective, the statute and the budget reflects that these funds are in the domain of the Department of Human Services, and we believe that is a more appropriate fit for some of the reasons that my colleagues have articulated, as well as some additional points that I'd like to make. One of the key concerns that we've heard from a number of our programs is just the accountability around these funds. Since July of 2012, we are aware of a not insignificant amount of money which has been either de-obligated from shelters or not obligated at all. There has been approximately $200,000 in federal funds. The state receives funding through the Family Violence Prevention and Services Act. We sometimes call it FIPSA. So there has been about $200,000 in FIPSA funds that were not awarded in the community-based grants process that was done for the federal fiscal year 2013 cycle. We're not sure where those funds were spent instead. There was also an estimated $190,000 in FIPSA funds that were historically awarded to the Georgia Coalition Against Domestic Violence for training purposes and outreach. Those funds are not being allocated in that way. And there's also been at least $10,000 in domestic violence funds that were de-obligated from individual programs based on contract compliance issues. When we'd asked about where those funds are being allocated, we have not had much success in getting specific answers. I was happy in yesterday's hearings to hear that Representative Oliver has requested a list of how all of those funds are being allocated, so I'm hopeful that might clear up some of the questions that the programs have, but I think that's indicative of the lack of transparency that a lot of the programs have perceived in trying to work with the Governor's Office for Children and Families. As was mentioned before, folks feel like, these are taxpayer dollars, and just as the shelter should be accountable for how they're spending it, so should the funder be accountable for how they are allocating those funds. In fact, this issue has even come to the attention of the federal funders. So the FIPSA funds are come down from the federal level through the Department of Health and Human Services. There is an office within HHS that does oversight of those funds. They actually did a site visit for Georgia based on concerns that they had about how these FIPSA funds were being allocated, and essentially asked the state to enter into a corrective action plan. The feds are now looking at Georgia again to see how those funds are being administered, and so I think that's another sign that this arrangement may not be working out as well as we had hoped. We've also had some concerns about issues with whether or not certain trainings that the Georgia Coalition Against Domestic Violence and other organizations provide will count towards the CEUs, the continuing ed requirements that all advocates have to have. For the past 14 years, the coalition has provided trainings to the shelters. We are nationally recognized as the subject matter expert on domestic violence in Georgia, but for the first time this year, GOSEF said that they will no longer honor CEUs earned through trainings provided by the Georgia Coalition Against Domestic Violence without offering any substantive reason, in terms of the quality of the trainings, that they would not honor them. Additionally, in Dee Sims, the Macon program had a training that she had put on for Domestic Violence Awareness Month. She was told that she would not be able to honor or to grant CEU credits for all of her training. The Governor's Office for Children and Families went through and cherry-picked, well, we'll give credits for this session, but not for this one, in a way that seemed to be political, frankly. I've got the agenda for the training, and they said that they were not going to provide CEUs for trainings on working with victims with disabilities, domestic violence, the victim's voice, connecting the dots, providing culturally competent services, and an up-close look at family violence intervention programs. It has been confusing to us as to why there has suddenly been this effort, it appears, to not honor quality trainings that have been offered extensively in the past. And I know my time is up, so I'll just close by saying that we really believe that the Department of Human Services is the appropriate entity to regulate those shelters and provide the funding. We would ask that you consider adding language in the budget to make that clear, to give effect to what I believe is already legislative intent, in that the statute provides DHS should regulate the shelters. And we appreciate your consideration of our concerns. Be happy to answer any questions.
Thank you. Are there any questions from the committee? Thank you. I think next on the list is Rebecca DeHart.
That's my last name, so it's sloppy. I'm sorry.
No, I thought that was it, but I thought, well, no, maybe not.
There's one more on domestic violence.
Oh, is there? Oh, okay. Well, I'm sorry. Yes. Tell me. Who?
My name is Alexis Champion. I'm with United for Safety.
Alexis, if you'll just, will you let us do that, and then we'll come right back to you?
Of course.
Okay, come on up, Alexis.
Hi, thank you so much. My name is Alexis Champion. I'm with United for Safety. We're an organization based here in Atlanta, though we serve the state and the Southeast. We focus on providing services and trainings for programs around gay, lesbian, bisexual, and transgendered survivors of domestic violence. And I'm here today just to share some of our concerns. Over the last few years, we've applied for several grants, and we have not been approved for any of those grants that we've applied. Most recently, we did apply for a portion of the FIPSA funding that Shelley Centerfit just mentioned, the community-based grant. We did reach out to GOSIF to ask for an explanation of what happened with that grant application. Our grant was not, according to what they shared with us, our grant was not reviewed based on a technicality that had not been signed in blue ink. We're looking at possibly filing an open records request to see. I don't have the original copy of that grant to know that for sure, but we did reach out to the person who wrote that grant, and she says that she did sign it in blue ink. So anyway, what I really want to focus on today, though, is moving forward and just explaining why I'm here to say that this is a real need, and the city of Atlanta is in a very unique position. I've been in contact with and working with an associate professor at Emory University named Rob Stevenson, who's done a lot of really great research, specifically with gay men in the Atlanta area. It's the only study of its kind in its breadth and scope. He interviewed 1,100 gay men in the Atlanta area about intimate partner violence. And what he found is that anywhere from 25 to 30% of those people interviewed had experienced intimate partner violence at some point in their lives. A CDC report just came out a few weeks ago that looks at all different types of relationships, lesbian, bisexual women, bisexual men, gay men. They found staggering numbers. Bisexual women had a rate of 55% having
have experienced intimate partner violence at some point in their lives. That's double the rate of heterosexual relationships in traditional studies. So this is a real issue, and there's an opportunity here, having Emory right here in this area, and to be able to really take this research and implement evidence-based practice. And so I'm just here today basically to say that we want to be active in this community, and part of what United for Safety can bring is training to the programs that are already in existence around the state on how to work with gay, lesbian, bisexual, and transgendered survivors. There are challenges to those things. Obviously, how do you shelter a gay man when you have a women's shelter in place, and other challenges like that. And so we want to provide technical support. We want to try to pave the way to provide real answers and real solutions to make sure that those people are being served. And part of our concern is that this not be a political issue. I think that maybe some of the barriers to United for Safety being able to access funding and move forward is that it's a kind of a hot topic right now with gay marriage, but this is about intimate partner violence, and this is about safety. Intimate partner violence costs taxpayers a lot of money with lost wages from survivors missing days of work, from survivors accessing emergency room services and things like that. And especially within the LGBTQ population, which is our shorthand for lesbian, gay, bisexual, transgendered, there are unique issues. For gay men in particular, there can be a higher risk of HIV, especially if they're in an intimate partner relationship that's violent. They may not have as much control over negotiating safe sex practices and things like that. This is a public health issue. There's a lot of information that we have that we can share. There are a lot of tools that we can provide if we can just be given the support we need to get the information out there, to provide the training, and to raise awareness for this issue. Thank you very much.
Thank you.
Sure.
Okay, is that on? Yep, it certainly is. Do all our shelters, they don't discriminate on... Okay. Now, I know we have shelters for women. I should know the answer to the next question. Do we have shelters for men?
I'm not aware of a domestic violence shelter in the state of Georgia that is specifically for men. Shelters they cannot discriminate. However, there's cultural competency as far as if you get a hotline call from a survivor who is male, being able to hear what he's saying, how he's describing his relationship. One of the challenges can be identifying the primary aggressor. You can't rely on traditional gender roles. A lesbian survivor, for example, may have fear that if she goes into the women's shelter, her partner can simply call and say that she's the victim in the relationship, and if they're using a different name or things like that, it's possible that it's not as safe. It's because it's a women's shelter. So there are complications that a trained advocate would know how to negotiate those issues, but the trainings need to happen for that.
Where do the men who are subject to domestic violence, where can they go if they have to flee their home?
They can call me, and they can call their domestic violence shelter or program in their area, but sometimes there may be barriers for the reasons I just mentioned, accessing services there. Not intentional, but our organization can advocate on behalf of someone looking for services. We're trained to hear, to look for who is the primary aggressor in that relationship, and to just be aware of the unique aspects of intimate partner violence that may be to that relationship.
Okay, but I'm going back to my original question, which is if a woman fears for her life in the home she's in, she can go to a shelter and stay there.
Right.
My question is, do we have anything for men if they fear for their life? Where can they go?
Most domestic violence shelters in the state would look for alternate solutions, such as putting them up in a hotel. There was one shelter that unfortunately they lost their space because of damage to their property. They had a setup where they had separate rooms, and so they were able to house men in their shelter specifically. But as far as I know at this point, it would be looking for alternate solutions such as a hotel.
Thank you.
Thank you.
Thank you so much for sharing that with us. Next, back to Rebecca DeHart. Thank you.
Thank you, Madam Chair and members of the committee. I'm going to be real brief so that the director of the Georgia Network to End Sexual Assault can speak a little bit more today. But we wanted to thank you for having this public comment today. To introduce myself, I'm Rebecca DeHart. I represent Ganessa down here at the Capitol. Ganessa is the coalition of the 27 sexual assault centers throughout the state. It's sort of the collective voice for those 27 centers. We're here for a couple reasons today, and we do want to say that we really support our colleagues and what they have said today. But our number one pressing issue this year is funding. And so what we're hoping today to do is to provide sort of a snapshot of the fiscal health of the sexual assault centers throughout our state, and then also to demonstrate our commitment to partnering with you all to keep that fiscal health healthy throughout the state. Shelley Centerfit described the money and how it was over at DHS and then it goes over to GOSIF by MOU. Another thing that's, I think, interesting and slightly confusing is just over $600,000 of that money is actually the money that goes to the sexual assault centers. So sexual assault doesn't have its own line item. We're actually lumped under the category of family violence, which isn't always necessarily the case. And it can make it a little difficult to advocate, particularly on sexual assault centers or domestic violence shelters, when we always have to kind of describe the difference between the two. And so that's one thing we've talked to many of you on the committee and to the budget offices about spelling that out a little more clearly, that sexual assault money is under the family violence umbrella. And then the other thing we wanted to talk about today was the centers and the $28,000 that the centers receive. Give you a little bit of an idea of the center that had to close this year due to being overwhelmed. They did not have the money to keep their doors open, and the several centers around the state that are struggling to keep their doors open as well. So if it's okay, I'd like to give the rest of my time to Jennifer Bivens, the Executive Director of Ganessa, and she can go into some more specifics.
Thank you very much for this opportunity to speak. So Rebecca gave you a sheet, and it talks about basically at the bottom, on the front, all of the core services that sexual assault centers across the state, the 27 centers, what they provide. And those services are provided with the $28,478,000 that 22 of the 27 centers receive. So not all centers across the state receive that state funding. They have to come, look for other options for funding. So our request for you to consider, for you to respectfully consider, would be for an increase in funding to our centers across the state. They do a wonderful job in servicing the victims in their communities, and as you can see, this totals over 13,000 sexual assault victims. Over 7,000 of those were child victims. Again, they do a very good job to the best of their ability with the money that they receive, and we would, like I said, request fully respect that you consider looking at if there is funding availability to centers for the services they provide, to continue providing the services. Rebecca mentioned Vidalia did close back in July of 2012 because she said, Jennifer, we can't sustain what we do with $28,000 for the sexual assault services. And so we have, Albany serves over 20 counties in her area. So that's a lot of counties for a victim to have to go through and try to reach all Albany Center. Several centers try to provide satellite offices, but not all centers have the funding to do that. Again, you're looking at $28,000 if they're lucky to have some federal funding to help support that. But again, it's a struggle. We have looked at other states and what they are doing with funding to help support their centers across their states. And so we've been in conversations with other states with successes that they've had and failures that they've had with regards to funding. And so we have talked to several members to discuss what that might look like here in Georgia with some funding options. And again, we're continuing to look. We don't want to come empty-handed to you and say we need funding. We want to come to say here's some options we're looking at. Would you consider looking at these within our state? And so I want to thank you very much for what you're doing. Thank you very much that we have maintained the funding that we have right now, and would, like I said, just to consider respectfully consider an increase if you guys are able to do so. And if you have any questions, thank you.
Are there any questions? No. Thank you. Thank you so much. That is the last of the names I think that I see here on the list. Is there anyone else here who has any comment or information you'd like to share with us today?
May I ask, is the $600,000 all federal money?
No, state is all state.
Yeah.
626 and some change.
Is state.
That's correct. $28,000 per center of that is all state funds.
Yes.
Help me to understand, we have separate monies for the shelters. Is that correct?
Yes.
Okay.
If I may respond?
Do we have separate monies for the shelters? I know the centers and the shelters.
That's right.
And I guess I'm going to let you explain that to me afterwards.
Sure. There's a total of about $14 million, but it's all under a single line item in the DHS budget that says Family Violence Services. So it's not broken out how much of that goes to sexual assault and how much of it goes to domestic violence. However, as a matter of practice, what has happened is, as Jennifer said, there's been about $626,000 that has gone to sexual assault, and the balance of that goes to domestic violence.
Of the $14 million, how much is federal, how much is state?
That's been a moving target over the past few years. So right now, all of it is state, except for about $2.5 million in FIPSA funding, the Family Violence Prevention and Services Act that I mentioned. The rest of it has been state. You may recall, though, a couple of years ago, it used to be a mix of state and TANF federal dollars. There was one point when all of the state dollars were replaced with TANF dollars. Some questions were raised about whether or not that was an appropriate use of TANF dollars. So last session, y'all flopped it back. You replaced all the TANF dollars with state dollars. So that FIPSA is the only source of federal funds for DV now.
And during that time, that just over $600,000 always remained state funding when the domestic violence shelters went to the fully TANF funding.
I have another question. None of these folks, but I'm just looking behind me and I see a whole bunch of folks from, I guess, the governor's office.
Yes.
6 of you?
Yes.
This is your staff?
Yes.
What is your administrative budget for your department?
It looks different for each division.
I mean, okay, how many people do you have in your department?
25.
Okay, so is a lot of the grant money going to the administrative, or is it going out to help the people?
Out to help the people.
Okay. Are there more grants or more dollars that we could access than we're accessing right now? For both family violence and sexual assault?
Out of our agency budget, there isn't, because we also cover many other child abuse, juvenile justice, other funding.
Are there other federal dollars that you could access?
I haven't seen any other federal grant opportunities for us to apply for recently. Dahlia would know.
Okay. I also am confused about one other thing. Going back to yesterday, when we were talking about overhead on your department, And we were talking about separate buildings, separate places, and everything else. Explain the difference between the shelter that houses someone who flees her home or the people that maintain, so to speak, a hotline or something like that where they can give advice, tell people how to go through the court system or something else. I don't quite understand why those sort of get lumped under the same budget. I would think that the shelters would be one, and then the centers that, where people maintain phone lines, are able to give advice to folks, help them navigate through a system, where to go for assistance and everything, would be another. But yet I'm seeing where you consider that 10% overhead towards the shelters when it's actually, in a way, serving a little bit of a different group.
If it's a direct service staff, we count that office space towards direct service and not indirect.
What's direct service?
Direct service is what we've been negotiating with the shelters, so what's considered direct client assistance. So it's indirect would be the supervision. So I don't meet one-on-one with the clients. I don't answer the hotline. My goal is to manage the staff. So that would be a total indirect cost.
It seems like there'd be a separation between the people that physically come in and stay at a shelter, and for those that just call in and use phone-type services or navigational services, because not everything is, I need a place to stay. Oftentimes it's how to navigate through a system, and they seem like they're somewhat different. I don't know. But it seems like one of them needs a physical place to go to, where a woman could need a physical place, and the other could be that I need advice.
Right.
So are we putting separate dollars and not taking dollars from the shelter where they would house a woman, or is it all lumped into one?
It's all lumped into one. Some of the bigger shelters will have community outreach offices. They may have them in different counties, but that's dependent on the shelter. It's not something where a different community outreach office is required by our office.
And sometimes, isn't it that they'll have an office outside of the shelter because of the need for all the rooms in the shelter to be given, used as sleeping rooms?
Yes.
Okay. Are we providing adequately in terms of ensuring that we have adequate space for folks that have to leave and to be able to sleep in a shelter, to have a safe place to physically be?
Well, the bed need in Georgia is greater than the beds we currently have. That's across the state. So, we're limited on funds and what we're able to do.
Is there no way to free up any additional funds that come into your department through all the grants that you get?
At this time, all of our dollars are tied.
Would you like to see us try to find more money for the folks that have to flee their home? You and I have never been in that situation, and we're very, very fortunate. But I'd hate to be a person that's in that situation and either be turned away or not to find a safe haven in which to be able to physically go. So I'd really like to urge and encourage you to find more dollars to be able to provide for more of the folks that need the type of shelter.
Any other questions or statements? Yes, ma'am. Would you go to the microphone?
My name is Anna Blau. I had not planned to speak today, but the thought that any shelter could close or potentially close due to any funding cuts troubles me deeply. I run a shelter that provides culturally sensitive services to refugee and immigrant women who have fled domestic violence. But more importantly, about 30 years ago, there was another refugee who fled her home after her husband knocked out every one of her teeth. I am that refugee. There was no place for me to go then, and if there was, I certainly couldn't find it. There may have been one shelter in the entire state, I don't know. I don't think that unless you've been through that, where your teeth are no longer there, where you can't share what happened to you with anybody else because you're so ashamed, and you have no place to go but your car. I did have a car. I wasn't that homeless. I had a car. I cannot sit by and just not say something that the women we have served, all of us, all the shelters, have not only survived, but they've thrived. They're not victims. They're survivors, and we have to look at them that way. This was 30 years ago this happened to me. I've been in this field for that long. I have been in this field, and yes, men are being abused as well, because we do provide alternative lodging for them. But if any one of, we had one victim that was murdered less than 3 months ago, made the newspapers, because she chose to go back. And that was her choice. We can't tell somebody what to do. But that opened up, as sad as that was, it opened up a bed for somebody else who had been stabbed and shot. And that victim survived, and she is now surviving and thriving. I brought with me one of my staff who's worked with me for 15 years and came to our shelter as a victim and is thriving and surviving. She goes all across the state to speak. I'm asking that you really do the right thing here. This is not about one shelter competing with another. This is about being human and do the right thing and not cost anybody else their lives as it could have cost me 30 years ago. Thank you.
Thank you, Ms. Blau, and I've heard such good things about the work that you do, so thank you for sharing that. Any other questions? Okay, well, for today, that will close this opportunity. I think that y'all all know that you can reach me and come see me in my office, and certainly the committee members as well. We're about to go through a difficult process. Y'all know that better than we do. You've probably been advocating longer than many of us have served up here. But the goal is to do the best that we can and to try to find the resources to help you in the work that you do. So thank you. Thank you for pausing today. This adjourns our meeting. I've got some handouts for y'all too.